Two Phase 3 trials. Testing oral semaglutide for early Alzheimer's disease failed. This matters to Ozempic or Wegovy users because both contain semaglutide. The trials enrolled 3,808 adults and measured the main outcome at 104 weeks. Semaglutide changed several laboratory markers but did not slow worsening memory or daily function. Its proven benefits for diabetes, obesity, heart risk, and kidney disease remain intact. The trials tested semaglutide as a daily tablet. Semaglutide copies some effects of a natural hormone called glucagon-like peptide 1. That hormone affects appetite, blood sugar, and inflammation. Researchers hoped these effects might protect stressed brain cells. However, the clinical results showed that changing these body signals was not enough. These were two large Phase 3 trials. They enrolled adults 55 to 85 with mild memory problems or mild dementia. Each participant had evidence of amyloid, an abnormal protein linked to Alzheimer's disease. This was not a study of healthy adults worried about future memory loss. Participants received daily oral semaglutide up to 14 milligrams or a placebo tablet with no medicine. That amount was the target dose. Treatment assignment was random, and neither participants nor researchers knew who received the active drug. Both groups continued standard care. The main scale measured memory, judgment, sense of time and place, hobbies, community activity, and personal care. Higher scores mean greater decline. After 104 weeks, both groups worsened by almost the same amount. In one trial, semaglutide scored only 0.08 points better than placebo. That gap was too small to show a real benefit. In the second trial, semaglutide scored 0.10 points worse than placebo. Both gaps were small enough to occur by chance. Semaglutide also failed to preserve daily function or delay progression to dementia. No benefit appeared in people with early Alzheimer's symptoms. That answer breaks a popular assumption. Alzheimer's is sometimes called type 3 diabetes because insulin problems and inflammation can occur in the brain. However, that nickname is not a diagnosis or a treatment guide. Better blood sugar control does not automatically stop Alzheimer's damage. The disease includes amyloid buildup, harmful protein tangles inside brain cells, failing connections between cells, and cell loss. These processes interact over many years. Semaglutide may improve how the body handles energy and lower some inflammatory signals. Those effects did not protect thinking or independence after symptoms appeared. The biomarker result explains why the story can sound confusing. Several laboratory markers improved with semaglutide. A biomarker is a laboratory sign, such as a blood protein related to inflammation or nerve injury. It can show that a drug affected part of the disease process. A changed marker is not the same as a changed life. Patients need slower memory loss, better function, or independence. Those outcomes did not improve. The trials showed laboratory changes without meaningful benefit for patients. When mild Alzheimer's symptoms appear, brain damage may have developed for years. Lowering inflammation then may be too late to restore lost connections. A drug can move blood markers while the disease keeps progressing. Blood markers can improve while memory and independence continue to decline. That failure matters because semaglutide has a strong reputation. Ozempic lowers blood sugar and reduces heart and kidney risks in appropriate patients. Wegovy produces substantial weight loss and can reduce major heart events in eligible adults. Success in those areas created expectations that the molecule might protect the brain. Those expectations deserved testing, but they were never proof. Animal studies can suggest how a drug works, and earlier results can guide later trials. Health record studies show patterns, not cause and effect. None can replace a randomized trial designed to measure Alzheimer's progression. Studies using health records suggested that semaglutide users received fewer dementia diagnoses than users of some other diabetes drugs. The difference could reflect a true preventive effect: healthier users, better medical access, weight loss, or differences between the people being compared. Only randomized prevention trials can determine whether semaglutide reduces dementia risk. Random assignment helps balance those hidden differences. That makes the placebo comparisons in these trials more reliable. Once symptoms were present, adding semaglutide did not meaningfully change the 2-year course. These randomized trial results are more reliable than earlier health record findings. However, these trials did not answer every brain health question. They tested treatment after mild symptoms appeared and amyloid was confirmed. They did not test whether years of obesity treatment could reduce future dementia risk in people without symptoms. Timing and treatment goal matter. For established Alzheimer's, semaglutide failed to slow worsening memory and function. For long-term risk reduction before symptoms, evidence remains incomplete. Prevention before symptoms needs randomized trials designed specifically to test it. The fact that these trials use tablets does not change the result. Participants took 14 milligrams of oral semaglutide rather than weekly Ozempic or Wegovy injections. The medicine itself was still semaglutide. An injection would need its own successful Alzheimer's trial before anyone could claim it works better. The same rule applies to dose differences. A higher obesity dose can produce more weight loss, but greater weight loss does not equal stronger brain protection. Weight loss and brain protection are different outcomes. A higher dose needs direct evidence that it protects memory or daily function. For someone already taking Ozempic or Wegovy, this news is not a stop signal. The trials did not show that semaglutide causes Alzheimer's or worsens memory. They showed no meaningful benefit as a treatment for early Alzheimer's with symptoms. The original reason for treatment should guide the decision. Someone using Ozempic for type 2 diabetes should judge blood sugar control, heart and kidney protection, safety and tolerance. Someone using Wegovy for obesity should judge weight response, health improvement, side effects, and the ability to continue treatment. Diabetes and obesity benefits remain separate from the failed Alzheimer's use. A different mistake is using semaglutide specifically to treat memory loss. Social media claims are not a reason to start it for Alzheimer's disease. Weight loss, nausea, dehydration, and reduced food intake may be especially difficult in older or physically weak adults. Treatment should have a clear medical reason. Memory symptoms still require a proper evaluation. Depression, sleep apnea, thyroid disease, vitamin deficiency, medication effects, stroke, and other conditions can mimic or worsen memory problems. The cause must be identified before choosing treatment. Semaglutide cannot replace that medical evaluation. For confirmed early Alzheimer's, treatment discussions may include medicines that help symptoms and newer drugs that remove brain amyloid. Those options have different benefits, risks, testing requirements, and access limits. Other Alzheimer's treatments remain available, while semaglutide failed as an Alzheimer's treatment. Semaglutide changed some laboratory markers, but did not preserve memory, thinking, or daily function over 2 years. It should not be presented as an Alzheimer's treatment. Its proven benefits for blood sugar, weight, heart risk, and kidney risk remain separate. Judge the headline using 3 questions. Who was studied, what changed, and what was the drug supposed to treat? Here, the participants already had symptoms, and semaglutide failed to slow memory or functional decline. Prevention before symptoms remains unproven and requires its own randomized trials. Ozempic and Wegovy are powerful medicines, but they are not universal protection against every disease linked to obesity or inflammation. The Alzheimer's result shows where the evidence stops. Good medicine preserves proven benefits, rejects failed claims, and demands direct evidence before using a drug for another disease. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.